I think that this book and introducing clinicians to different ways of thinking about patients and thinking about what's wrong and how therapy might be able to help them could stimulate clinicians to want to learn more about different types of therapies, especially if they find that in their own practice there's a real need. And so if they find that they're coming up against similar difficulties or similar points of being stuck with patients, that a different type of psychotherapy, for example CBT, when they're doing more supportive psychotherapy, could address, we could really imagine that they would then decide to do more CBT training. The outline of the different therapies in this book is meant to be just kind of an introduction to the way different therapists think about therapy and not a comprehensive overview. And I do think learning about the different types of therapies and just even being in this world for the past year and a half or so has led both of us, I can speak for myself, I mean, I definitely much more likely to think about different treatments for patients, refer to an adjunctive treatment like a DBT skills group in addition to what I'm doing, or even, when learning about ACT, which is a totally different type of therapy. I had a moment with a patient where I just kind of thought like, wow, I mean, in a way we're kind of butting heads here, and maybe part of the problem is that we really see it differently. And if maybe, perhaps if you were working with somebody who conceptualizes problems in a totally different way, he would do better.